I'd like to start with the latest news out of Tokyo, where the Olympics start on Friday, and we heard that an alternate member of the US gymnastics team has just tested positive. Are you concerned that this global gathering of athletes could become a super spreader event?
I think everybody's worried about that, with people coming from all over the world, some of which are places that don't have access to vaccines yet. Obviously, the Japanese have responded by trying to very seriously limit the risk by stopping any in person attendance for spectators, but there's still a lot of athletes there. I understand about 80% of the athletes are vaccinated. That's the best way to protect against this turning into something worse. But obviously, this has got to be watched with great care. And presumably, anybody who tests positive is immediately isolated and their contacts are traced and probably also isolated if they had a high risk exposure and they weren't vaccinated.
Wow, yeah. So it brings me to a question actually about breakthrough infections. The CDC has said, or said last month, that I think there have been 4,000 people who were vaccinated who've had breakthrough infections of COVID. What exactly is the risk, given the rise in the Delta variant, to vaccinated Americans right now?
Well, it's not particularly a serious risk of hospitalization, and it's very low risk at all of serious enough risk to result in ICU or death. But remember, when we learned that the efficacy of those mRNA vaccines, the Pfizer and the Moderna, and the J&J vaccine was pretty darn good. It was not 100%. We thought 95% was just amazing, but that does say it's possible for breakthroughs to happen. And that was before Delta came along. Delta probably increases that risk a bit. You know, I run the National Institutes of Health with 46,000 employees, and we have immunized as many of them as were willing to come forward, which was most of them. And we are also, because we do our own testing, seeing an occasional breakthrough in somebody who was fully immunized. I will tell you, those people aren't very sick. They have mild symptoms. We've yet to see anybody really get in trouble. So I think what that says is, especially with Delta, the vaccines are still fantastically good, but it is possible for an occasional person to get mild symptoms and to test positive for the virus. And probably during that period to be somewhat infectious, although probably not nearly as much as somebody who's unvaccinated, where the virus has a much better chance of multiplying into very large numbers.